Well, it is 10 o'clock, and I want to welcome everyone to our weekly coronavirus virtual information session. As always, I want to ask you to keep your microphones on mute, and if you have anything, question to ask, that you do that in the chat. Next slide, Justin. As I said, please keep the mics off. You can keep your video off if you don't want to be recorded. Otherwise, it's nice to see everyone's faces. Type in the chat any questions, use respectful language, and the number to call if you are concerned about your health. You can call us at 588-4340, or you can call the Kentucky COVID-19 hotline at 800-722-5725. And then if you have any issues with your sound, you can click on the arrow next to the microphone to test your system if there's any issues there. And then lastly, I would love for you all to just put in the chat the county that you either are from or where you provide services to. That would be great. So thanks everyone. Let's start now first by asking our medical director, Dr. Christian Furman, to give us her weekly update.
Yes, welcome everybody, and I'm glad everybody's been with us every week. I look forward to this time to get to catch up. So the big thing now is, Kentucky is starting to open up, so I just want to make sure everybody remembers how to be out healthy at work and healthy in the community. And the big thing is to wear the mask. So it can be a homemade mask. It has to cover your mouth. It has to cover your nose. And if you need to take off your mask, they recommend every 2 hours to take off your mask so you can get a break. I mean, it does make people feel claustrophobic sometimes. You can get a paper sack and just put the mask in the paper sack. You have to take off your mask to eat and drink, so put it in the sack. That way it keeps it from contaminating the table and other places. And even with the mask, you still need to have 6 feet away from people. And the thought is that the mask, if people drift, you're supposed to stay 6 feet away, but sometimes people just, you start kind of forgetting and get closer. So the mask will, and the reason that you're wearing the mask is so if you're an asymptomatic carrier of COVID, you're not passing it to other people. And so it's the compassionate thing to do. Our governor, says it's the socially appropriate thing to do, the compassionate thing to do. It's your patriotic duty to wear a mask. So please wear a mask. He is starting to allow groups of to gather. 10 people can gather, but even with you gathering, you still need to wear the mask. You still should not be touching each other and hugging each other and passing things around that way. You still want to keep that 6 feet social distance. There's also this question about when to wear gloves, and this whole thing, it changes all the time. The mask have changed. I remember I was on NPR at the beginning of this, like, oh no, you don't have to wear a mask. Only healthcare workers have to wear a mask, and now we're saying everybody has to wear a mask. So things do change, but right now the CDC is recommending you wear gloves when you're cleaning or doing direct patient care with somebody. So like we wear gloves in the office when we're doing the physical exam. But just like when you're running errands, like the ATM machine, the grocery store, you don't have to wear gloves, but you do have to wash your hands because, when you're touching the ATM, all right, now you're contaminated. So you need to wash your hands for 20 seconds or use hand sanitizer that has 60% alcohol. You need to wash your hands with 20 seconds with soap and water, or use the sanitizer that has 60% alcohol. But, that might change. There has been discussion, okay, if you wear gloves, can you then wash your gloves and sanitize your gloves? That's not really the best. The best is just to get a new pair of gloves. I think it does depend on the PPE and how many gloves you have. And some people are just desperate, and we're doing all things during COVID times that we never used to do. You never used to reuse masks. You never used to reuse gowns. You never used to reuse gloves. The whole thing is a little bit crazy. So ideally, you only wear gloves when you're doing cleaning or caring for someone who's sick. And the other thing I want to just tell everybody, we did have the parade at Presbyterian Home last week for Older Americans Month, and for Nurses Week and Long-Term Care Week, and for Mother's Day, and it went really, really well. So thank you for everybody that showed up. It was like a half-an-hour parade, so which was great because they were thinking nobody would show up. And some of the residents, they loved it. It was a beautiful day. We picked the perfect day in between 2 rain days, and some of the patients were saying, the residents, they hadn't seen sunlight in 2 months. And so it was so good for them to get out, and it was really good for the staff to have something to look forward to. And it was good all along. So I'd encourage you all, if you know other people that live in long-term care, assisted living, personal care, these parades are really good ways to help people have something to look forward to, something positive. And then the other thing, I just want to kind of give an update for the long-term care task force that we serve on. We're meeting weekly now. And the big thing is all the nursing homes and long-term care facilities in the state of Kentucky are testing. They're testing all the staff and all the patients and all the residents of each facility. They try to do it all like in one day so they can capture everything. And then they're doing it strategically, though. They don't want to test everybody all the time, because then you do find positives, which they want to find positives. And then it impacts the workforce, because then sometimes staff can't come to work. So they have a strike team ready to help each of these facilities, but that's why they have to do it in order and strategically and not just randomly. So they would have the strike team that's able to be there. The other thing that we did is we did an update to the transfer policy. And now we're asking each of the hospitals to test patients before they send them to a long-term care, assisted living, personal care. And then when patients go to the personal care, or to the long-term care facility, there was always this 14 days of quarantine, because 14 days is the incubation period for the virus. But it was a little bit more detailed about what they're supposed to do during those 14 days. And now we are asking, you kind of treat them as a COVID positive patient, kind of, where you do want people to wear a face mask and the mask. So a lot of places were just wearing masks, but they're asking to wear the face shield also. So those are some of the updates. And then next week, I'm not going to be here. I'll be able to call in maybe, but I'm not 100% guaranteed to call in. So I'm going to, one of our other geriatrician colleagues will be in my place. So, and then at the end, I'll be able to answer other questions if you have questions. So I think it's exciting that we're able to start going back to work. I think it's scary a little bit, because the virus is still out there. So we do need to keep the social distancing, keep wearing the mask, keep washing your hands. But the reason we're able to go back to work and kind of go back into the community is that we know how the virus responds now. We have a better ability to test and track and do contact tracing. We have enough ventilators, we have enough ICUs, we have enough PPE. So things have changed. We're in a better position now. So everybody just practice and do all the rules and follow the rules. I think we'll be fine.
Thank you, Dr. Appreciate you getting the update. I'm now very happy to welcome you to this week's information session focusing on the topic of elder abuse during COVID-19. We are joined by members of the Louisville Metro Police Department Senior Crimes Victim Program, and they will share what their unit has seen in terms of elevated risk for elder abuse during COVID-19 and the resources available to us for protecting ourselves and family members. As part of this conversation, we will also discuss how COVID-19 has impacted the rates of domestic violence, both for older adults, caregivers, and the broader population. Just to give you a broad overview, the Senior Crime Victims Program, they assist elderly victims 60 plus who reside in the Metro Louisville, Jefferson County area. These crimes include elder abuse, neglect, sexual abuse, financial exploitation, and identity theft or fraud. The unit also provides 2 emergency services: an emergency crisis response team, which provides immediate short-term emergency shelter and home care services to Metro Louisville seniors aged 60 plus who are experiencing abuse, neglect, or exploitation as a result of crime. And then also an in-home emergency protective order service, a service that assists in the issuance of emergency protective orders for medically fragile or homebound elderly victims of abuse. Please join me in welcoming Sergeant Scott Shafer, a strong advocate for elder abuse prevention, and his colleagues. Sergeant Shafer, if you have other colleagues with you, if you can just introduce them, we'll really appreciate that. And the mic is yours.
All right, thank you for inviting us this morning. My name is Sergeant Shafer. I'm the sergeant over the Crimes Against Seniors unit here with LMPD, and I'm joined with Sergeant James Clark. He's the sergeant over the Domestic Violence unit. We're both part of the Special Victims unit here, and with the COVID scare right now, basically what this unit is seeing is we're seeing a big like a huge number of phone scams, more than we used to. And the only theory I have on that is, you know, people are quarantined and they're at home, so they're actually falling victim to the phone scams more than usual. And it didn't help that we got quarantined during one of the busiest phone scam seasons, that being the Irs Scam. So we've actually been quarantined basically all of tax season. So getting a lot of people falling for that Irs Scam. I'm going to touch on some of the phone scams we see, and then I'm going to turn it over, and the Sergeant Clark is going to give some numbers for domestic violence, kind of the trends we're seeing since the quarantine, and then we're going to open it up to any kind of questions that anyone has. The good thing, I guess, as far as the COVID goes, we are seeing a decrease in abuse neglect cases, but I'm sure they're still happening. They just might be going unreported right now. So that's kind of scary, but I have not fielded a call on an abuse neglect case in quite some time. Most of them are phone scams. And I touched on the Irs Scam. Another scam that we're seeing is, we call it the grandma scam. And this kind of how it goes is the scam artist actually calls the victim, and whether it's a male or female who answers, you know, they're like, "Grandma?" Well, now you got the victim thinking. She's like, "Who does that sound like?" And she's like, "Johnny?" And he's like, "Yeah, Grandma, it's Johnny." So basically your victim has given the scam artist his identity. And he goes on to say, "I'm sorry, I don't sound the same. I've been in a car wreck. I broke my nose, and I'm at the hospital, and they won't see me unless I get a copay. Is there any way you can send money?" And these calls usually come in late at night. The victim kind of, you know, she's worried that it actually is a loved one. So they go ahead and give information and get scammed out of that money. On top of that, we've got the Irs Scam, which I touched on. We're coming into spring, and with people being quarantined at home, I think we're going to see an increase in contractor scams, because when springtime rolls around, with the storms that come through the Ohio Valley, we get contractor scams. We call them storm chasers is what we call them. Basically, after a storm, they'll seek out the victim, like a tree will be down or something in their yard, and they pull up and they're like, "Hey, we'll take care of that tree for you for, you know, $2,500. Can you pay me up front?" The victim pays up front, and they never come back to take care of the tree. So it's never a good time to be quarantined and kind of sheltered in place, but it's a bad time of the year because tax season with the Irs Scam, and then springtime with all the storms. I'm sure we're going to see a lot of cases come out because of the contractor scams as well. Is there any questions so far on scams or anything?
Maybe I can ask you, what advice do you give people living in the community? How should they handle these scams?
As far as the scams go, when we give our presentations across the community, what I say is don't answer the phone. Most people have caller ID these days. If you don't recognize the number, don't answer it. But if you answer the phone just out of habit, don't be afraid to hang up. Because so often, you know, when we're dealing with the senior population, it's a completely different generation than what I grew up in. You know, they grew up, you know, handshake means everything, and a lot of times they just won't hang up the phone. They'll actually hear the scam artist out. And I mean, you know, like I've told at our presentations, scam artists, I mean, they could talk a wolf off a meat truck. I mean, these guys are good. You know, if they weren't good, they wouldn't do it. So don't be afraid to hang up if you do answer it. But honestly, if you don't recognize the number, let it go to voicemail, because if it's important, they'll leave a message. And then you can choose to call them back or not. Because what happens is if you fall for these scams, or you almost fall for them, like they almost had you, I tend to think that you kind of get moved to the top of the list, and they're going to try different ways to scam you because they know you're an easy target. So once you fall for one, don't be surprised if you get multiple phone calls trying to work different scams on you. As far as the contractor scam goes, the advice that we give is don't hire anybody who seeks you out. If you have a tree down in your yard or you need roof work or anything like that, you call and get three quotes usually is what we recommend. And then that way you know who you're hiring. You're just not hiring someone who seeks you out. Never pay up front. Reputable business will never ask for more than a 10% down payment. So if they're asking for all the money up front, no, don't do that. Does that answer your question?
Yes, thank you. Justin, there's some other questions in the chat. You want to?
Yeah, so there's two questions. First, how are you monitoring potential neglect and abuse during the quarantine? I'm sure this is much more challenging.
It is, because usually our abuse neglect cases, we'll get them like there's a duty to report through facilities. So if they believe there's any kind of abuse or neglect going on there, we do get those some, but I mean, honestly, the ones I'm seeing lately have been resident on resident, which that's not something we investigate. If it's a worker in a facility that's maybe mishandled someone and they're Medicaid funded, usually that goes to the Attorney General. I'm not seeing a lot of those, and I don't know and I don't know what the regulations are on long-term care facilities. I don't know if loved ones, if they're banned from coming to see anybody in those. I'm assuming they are. That might be a reason why we're not seeing a lot of reported cases. And honestly, if they're at home and they're being abused or neglected, and I think the DV sergeant's going to touch on this, I'm afraid that since they're at home with the perpetrator, they're afraid to call the police because everybody's quarantined together. So it might be underreported right now, which if that's the case, it's heartbreaking because a victim won't seek police help, because they're living at home with the victim. But like I said, right now, I mean, I don't think I've assigned an abuse neglect case in 2 months. And normally we don't get a lot of those, but, we should have received, a report on an abuse neglect case since quarantine, and I have not assigned a case on abuse neglect.
So I have a question, two questions related to potential scams. Have you heard of any potential scams related to contact tracing or with the stimulus checks?
I have not. The only report I got on a stimulus check so far was I had a power of attorney that mismanaged a victim's money, and before the state got guardianship of that victim, they believe the state guardian believes that the suspect received the stimulus check and cashed that as well. But I have not seen any scams related to the stimulus per se.
And then what do you recommend for door-to-door scams?
That's a good question, because I actually did receive a call on a door-to-door scam, and we get these a lot. Alarm companies, they'll come door to door and solicit, like they'll see you have a sign in your yard, ADT security, like that you have that system. And normally they do select elderly victims because, they believe they can easily manipulate them. And I did receive a call on this. Basically, these alarm companies, what they do is they hire people in the spring, and they get paid so much money for every alarm system that they sell. So they'll knock on the door and see and be like, I see you have ADT. Well, we're offering this. It's wireless. All the equipment's free, and it's $36 a month for 2 years. And really what they're doing is they're putting in the system, but more often than not, ADT, the victim still has a contract with ADT. So ADT's like, you still have a contract with us, And now they have this new contract. And I'll get a call from like a loved one saying, hey, I think my grandma or my grandfather was scammed. They were taken advantage of because of their age. And there's not a lot I can do with it, because this alarm company, even though they might have slick talked their way into selling an alarm system, the victims actually signed a contract. And I mean, in the eyes of the law, that's a binding contract. Now you've got a victim paying for 2 alarm systems. So as far as the door-to-door goes, I like to see people that don't answer the door, because once you answer the door and they start talking, they'll usually work their way in. I didn't think people fell for that until I came home from work one day, and my wife's got the not the Oric, the Kirby vacuum guys in my house. And I'm like, what are you doing? She's like, we ought to buy this vacuum, So they're pretty slick talking, They talk my wife into letting them come in and show the vacuum. And I was like, you got to go. Because on those alarm system companies, there's not a lot we can do, because they've actually signed a contract. The only thing that possibly can happen is a loved one can call and be like, hey, I think your salesman took advantage of my grandmother or my grandfather because of their age. And if the company answers the phone, which I'm getting a lot of reports that the alarm company won't even answer the phone on these, you might be able to get it canceled. But that's a contract they signed, and I do see that one a lot. Does that answer your question?
So somebody privately chatted me and said the alarm company situation actually happened to them, and they knew right away that it was a scam, and they asked them not to come back. But somebody also asked, what can we do during this time to help older adults who we suspect are being abused or neglected?
If you believe that you have someone who's abused or neglected, by all means, either call the police to do a welfare check on them, have the police go out and knock on the door, or if you want to call them and they're like, yeah, it's getting bad, then that third party should call and have a welfare check. And when the police go out, if the victim says, yes, this is what's going on, there'll be a report taken on that scene, and it'll actually probably go to, it'll probably be written up as domestic violence, and it would go to Sergeant Clark's unit, but depending on the age, it might come here. So if you suspect that someone's the victim of abuse or neglect, call and get a welfare check with the police, and you can also call and report it to Adult Protective Services. Because I think actually Kentucky's a duty to report state of child abuse or elder abuse. Like, you have a duty to report that to somebody. Does that answer your question, sir?
I think that, and they can follow up with me if they have more questions. Somebody questions, have you seen anything regarding scams using caller ID that comes up as senior and it's actually a scam? They say this actually happened to an elderly client who received it because it said senior care experts, but it was actually someone on the line that was saying it might be worth something about their Medicare using fraudulent caller ID. Yes.
With all the technology we have nowadays, for all the good it does, it also does some bad things. What these scam artists are doing is, I'm sure everybody's seen the infomercial for like Magic Jack, where you can like make phone calls through your computer. Well, with that, they can also spoof their number. So like the IRS scam, for example, on your caller ID, it might give a number and say Washington, D.C. So when the victim looks at that caller ID, they're like, whoa, it's coming from Washington, D.C., and they answer it, and now the scam artist is claiming to be with the IRS. So that seems pretty legit. You're like, calling from D.C., I'm getting a call from the IRS, I probably need to pay this fine. And it's a scam. These scam artists can spoof their numbers. They can call from Jamaica and make it look like they're calling from a 502 number. So that's why I always say, if you don't recognize the number, don't answer it. But if it does come up, senior care experts, and you're like, oh, let me answer that, and you feel that you're getting ready to get scammed, don't be afraid to hang up. But there's not a lot that we can do with the spoofing of the number, because as of right now, that's not illegal to spoof your number. There's actually apps you can buy on an iPhone to spoof your number. Did that answer your question, sir?
That was yes, thank you.
Anything else? I'm just going to talk a little bit about the domestic violence piece. Is that right?
Did you ask for the domestic violence sergeant to speak a little, because you cut out on us?
Yes, yes.
Okay. All right. I'll turn it over to Sergeant James Clark.
Good morning. So to give you some numbers that we have, our unit is actually down 2.8% in reporting from this time last year. And like Sergeant Shafer said, we attribute that a lot to the quarantine. Unfortunately, our victims are stuck with their perpetrators and aren't able to call. But the good thing about our unit is we have our detectives and our victim services unit that are still trying to reach out to our most vulnerable and to assist them. Excuse me. And patrol is still responding to all calls of domestic violence and taking appropriate action. So I don't know if there's specific questions, but I'll try to answer whatever you guys may have.
I think I would like to just make a comment before we go into some of these questions, is that all of these things we talk about to prevent scams and all that you just now said about the underreporting, to me feels like our older adults are just more and more at risk. You know, they are getting more isolated, they are getting more lonely, they can't really even answer the phone without being scared. And now there's also an underreporting of things that happen to them. So it feels like a very scary situation for me right now. I don't know if you've got any comment on that.
Yeah, and it is, you know, it is for us as well. But, you know, there's only certain stuff that our command is allowing us to do. So like home visits and all that kind of stuff, they've kind of limited those to where they're almost non-existent. So we're doing the best that we can with what we're able to do during the pandemic here, trying to reach out. Again, like I said, we've increased the size of our victim services unit. They're still working from home, but we keep in contact with them, send them reports on a daily basis that we feel like they need to follow up on. With some that we feel are in the most dangerous situations that we have, and look forward to coming out of this quarantine so we can actually, you know, do what we have been doing and try to assist them like we were before this.
And this is Christian Furman. I think, you know, the more I hear you speak, it's hang up on them and close the door. So you almost wonder if we need to have like some role plays with older adults and have them practice, because it just, people don't know what to do, and the more they practice, the more they'll know exactly what to say when this happens. So that's something that, you know, we could do with our patients when we work with our clients or different places. I think a script, to give them a script and practice the script with them, then they'll be prepared, because I think you can't just wing it when it happens. You have to have a plan in place, you know, to be prepared for this.
I completely agree with that. I mean, the only way to stop a lot of these scams is to educate the public. That's why we get out there as much as we can, and we do community presentations. And hopefully when we give those presentations, somebody from there will take the information they learn, and if they pass that along to 2 or 3 neighbors, you know, and just chain the information together. But like when you have patients and you're at their house working with them, by all means, if you walk through like what to do, because I completely agree. You know, you have to train, because that's how you'll respond. I mean, I come from the military and the police, and, you know, they say your training kicks in when something happens. And I mean, that's true. So, I mean, if they don't practice it, they won't know how to respond. But if you practice with them and say, hey, if the phone rings and you don't recognize the number, hang up. Or if somebody knocks on the door, don't be afraid to shut the door and say, no, thank you. By all means, practice that, because that's how they'll respond when the situation arises.
That's great.
So there's many more questions in the chat. Justin, are you going to handle them?
Yes, yes. So circling back to the first conversation, is there any support for making it illegal to spoof a phone number?
Not that I'm aware of. There's nothing like in a House bill or anything. I mean, it's basically legal to spoof your number anywhere in the United States. I mean, you can buy like little cards for like $20 and they'll let you spoof your number like so many times before the card runs out. It's kind of like a prepaid spoof card. And then on top of that, like we get a lot of scam calls through Cricket phones, or I'll use Cricket, for example, because they can be a prepaid phone. You know, like the phones you buy at a gas station where you put 40 minutes on, or $40 worth of minutes on there, and when the minutes run out, you can just ditch the phone or add minutes. A lot of times these scam artists will buy one of those phones, make 500 phone calls from that phone in a day, and if they get one or two people to bite on a scam, you know, and they send them $4,000, I didn't make $4,000 a day, and all they did was sit there and make phone calls, and then they'll just throw that phone away and go buy a new one. And when you actually trace that number, it comes back to an unregistered, like, Cricket user. Like, no, we have no way of knowing who bought that phone at the gas station, when they bought it, or anything like that. So if you take care of the spoofing, you still can't take care of the throwaway phones. And since you're touching on the subject, I get a lot of questions about the don't call list. They're like, I'm on the don't call list and I still get calls. And my answer to that is the don't call list really only applies to law-abiding citizens. I mean, most scam artists are criminals. They don't care that you're on a don't call list. And a lot of times these calls originate offshore from the United States, so they don't fall under our federal guidelines at all if they're making a call from Jamaica. So that's what we deal with the don't call list. I mean, if they're not a law-abiding citizen, they don't care about the don't call list.
So circling back around or moving into the elder abuse piece, what do you recommend for service providers to do when an older adult who is cared for by their family is reluctant to say that her family has taken over finances, mail, outside contacts, especially if the older adult doesn't want the service provider to call anyone?
In that situation, if the victim is alert and oriented and they're just being cared for because of their age, but they're able to make decisions, if a victim does not, by all means, if the service provider wants to call the police, they can call our number and I'll give that at the end of the conversation. But if the victim's alert and oriented and they don't want the police involved, we close that case. Victim refused to cooperate. Now, if they have a diagnosis of dementia, we can kind of go around that because they have decision like their decisions can be skewed because of the illness they have. But if they're alert and oriented, no diagnosis of dementia, and we get that a lot. We'll get a third-party call. We'll call the victim, and then the victim says, "That's my granddaughter. I'm not going to put her in jail," even if we know there's something going on as far as exploitation. We have to close that case. But now, on the other side of that, if it's physical abuse, there's still that's a duty to report. Like, that's domestic violence. Like, basically, KRS, that's the Kentucky Revised Statute, basically says, you know, there has to be a report, there has to be an investigation, and if the police show up on a domestic dispute, basically they have to determine who the primary aggressor is, and someone has to go to jail.
And that actually, this follows up on your about is there a number to call? And I can put that in the chat, and we'll also share that on our website for people to make reports.
Well, if they have any questions concerning the elderly, our phone number is 502-574-2278. That's the main line. And another number, since the quarantine, if you have a victim that maybe wants to file a police report and it's not like domestic violence related or anything like that, you know, just to put it out there, like if somebody steals something from their garage or something, we actually have a telephone reporting unit now where they can make those reports, and that number is 502-574-4661. But that's basically for like non-emergency reports, if you wanted to put that on there. So an officer doesn't have to come out because it's a non-emergency, and they can still get that police report filed.
Okay, so lots of questions here. Can we do an information campaign where we get information to older adults in our communities to help them know what is going on, or is there such a campaign that you know of?
As far as a campaign, no. I know that some of the news stations will put, like when we start seeing an influx of certain scams, you know, the news will do a little segment on scams. Really the only thing that we do as the unit is we attend like the Triad monthly meetings and get information out there to that. And we just do, when we're called and asked to do a community meeting, we go out and do those. And I'd say we probably do 60 of those a year to just try to get the information out there.
Okay, and just for everyone, just can you let us know what Triad is, and I'll put that in the chat as well.
Triad is a monthly meeting. It's the second Tuesday of every month. They just now celebrated their 22nd anniversary, and it's kind of like a three-prong effort for to get information out to the older adults in the Jefferson County community. It's law enforcement and the Office of Aging Adults with Metro and the community. That's like the three-prong effort when it was started. That's why it's called Triad. And it's just a monthly meeting where they just get information out for the older adults. Like I always speak at Triad. I get like 5 or 10 minutes to give an update, and that's when we usually do our legal update, like scams we're seeing in the area.
And Justin, this is Christian Furman. Sarah Teeters, who worked with us at the Institute a lot, she's part of that through the mayor's office too. So yeah, the Institute's gone to present at different times.
So how do patrol officers handle responding to calls in which a victim has an older adult, has concerns for their safety due to threats and or behavior of domestic violence, but is also concerned that the behavior of their older spouse may be connected to dementia and or Alzheimer's diagnosis?
You're asking how a patrol officer would handle that situation?
Yes.
I would assume that the call would come out like as a trouble run or maybe domestic violence related. I'm sorry, are your questions referring to like both the victim and the perpetrator are older adults?
That is my assumption, yes.
Okay. In a situation, it's hard to Monday morning quarterback like what an officer would do once they're on scene. But if they got there and like the perpetrator was the man and he's suffering from dementia or like a diabetic related cause to cause the violence, and say he hits his wife and she's elderly as well, or pushes her down, or there's just some kind of physical altercation. If the officer can deem that there's a medical emergency going on there, I don't think that they would just throw them in the back of a police car and take them to jail. If the medical emergency maybe caused the domestic violence, they would probably go to U of L. But there would have to be some kind of court, proceeding, because there was domestic violence abuse, even though the cause might have been because of an illness. It's hard to say without like being on a scene, but I mean, you can tell when someone's having like a medical emergency, and that could have led to the violence. And if they're both elderly, I would assume that the officer, instead of taking them to jail, would actually take them to U of L. But within 2 weeks, there would be a court proceeding where they would have to go to court. And if it showed that that was a medical emergency that caused it, that would probably get dismissed. Does that make sense?
Yeah, I think that's really a good point because the police are putting, this is Dr. Furman again, Christian Furman. I think, the police are put in these awful situations where, my brother's a police officer. And so I've heard these stories, and it's a lot of dementia that's causing these issues. And so it's really great that the police force is trained in dementia and they know that it's a medical issue. But I think as providers, I think a lot of people on this Zoom meeting here are providers with older adults. I think it's our job as providers to intervene before it gets to calling the police, right? So, we get the families come to us and the patient is having behavior problems, and the dementia patients have hallucinations, they get paranoid, they have a gun. The VA did a big intervention because all these veterans have guns, is to get the guns out of the home, to get the behavior treated. There's good medications to treat behavior. There's good, you don't want to start with medications, you want to start with non-medical treatment, but good programs to give the caregiver break, to give a better environment for the older adults so they're not having these behaviors. So I think it's our job to intervene early before it becomes a crisis and the police are called, So there are warning signs, and so you all are put in an awful position when you have to go out there.
Yes, ma'am. And we have trained on dealing with older adults. And also, I think last year we got our training on dealing with people with autism as well, because, sometimes they don't respond to, the police show up, and you're telling them, show me your hands. Well, maybe someone with autism misses those social cues. So we have received training on how to deal with that as well.
And the good thing about that I'll mention is that the entire department gets that. So we have a yearly in-service that we all have to attend. So officers, detectives, commanding officers, all that get that same training.
That's really good. That's really good. You all do an amazing job.
So any suggestions for how we can do community information presentations, especially during the quarantine?
During the quarantine, it's kind of hard. We're doing the Zoom calls, but when this quarantine's over and we can get back out there and start giving community presentations, people can call that 574-2278 number and request that we come and give a presentation. And we just ask that we give it about 2 weeks notice to schedule those, and we'll get somebody out there to give those presentations.
And so this is for kind of a question outside of Jefferson County. Are there resources related to Triad or anything that's statewide or reaches out to outlying counties?
That would probably be a good question for Sarah Teeters. I don't think so. I think Triad is just basically for the Jefferson County community. There are senior groups throughout the state that meet and talk about problems with scams and stuff. But as far as crimes against seniors, we're lucky here in Jefferson County because we're one of only two that have a crimes against seniors unit. We have one, and so does Lexington Police Department. They have 2 detectives that do it, but the rest of the state, they don't have any kind of specialized unit that deals with crimes against seniors. And to be honest with you, there's not a lot of them nationwide. I'll receive calls a couple of times a year from other police departments, from other states, and they ask what we investigate, what's our manpower, what's our caseload, because they're wanting to get that up and running in their own police departments, because the senior population is, with the baby boomers and everything becoming seniors, we have a huge senior population. And it's good to have that specialized unit because, they're trained on how to talk to people with dementia, how to interview them. So I look for crimes against seniors to actually be one of the biggest growing units probably nationwide here in the next couple of years. We've had one since merger, so Jefferson County is actually really lucky. I think this unit was formed 2003, I think, and so we've been around for 17 years. So we were way ahead of the rest of the country as far as getting a crimes against seniors unit.
And I want to acknowledge that there also in the chat is to relieve scam alerts from the Kentucky Attorney General's office. There's a number, and then also to report scams, there's a hotline for the Office of the Attorney General.
That's correct.
And then also that triad is actually in other communities as well. So there's information about that as well that we will put on our website. And then someone also indicated there's an adult multidisciplinary team in a few counties in Kentucky that sound very similar to triad. So there seems to be a lot of resources in other parts of the state as well.
And I will say this is Dr. Furman, the Crimes Against Seniors Unit is so helpful because a lot of times before that was invented, I mean, if you had an issue, you would call Adult Protective Services, but like a social worker coming to your door to kind of figure things out is different from a police officer with a gun coming to your door to figure things out. So the Crimes Against Seniors Unit can really get things done when APS cannot get things done. So yeah, you've done a great job helping a lot of our older people. So yeah, thank you all very much.
Thank you.
This is Pam. I also wanted to let you all know about Age-Friendly Louisville. Age-Friendly Louisville has been really trying to work on trying to get information out there about elder abuse. And so if you go to the Age-Friendly Louisville website, there's information that has been pulled together from several of the different committees looking at elder abuse and resources to communicate. So there's information there, as well as Age-Friendly Louisville is also working on some first responder information training that hopefully they're going to get out in the next 6 to 9 months.
Any other questions that anyone has for our guests?
I have a question. So as someone that at times in my life have been hesitant to call the police, I live in Germantown and I've seen my neighborhood change much over the 10 years I've lived here, but I would call the police for suspected domestic violence several times a year when I first moved in, and that's thankfully changed a little bit. But can you give me a little bit of peace of mind for that hesitancy to call, of getting the police involved in somebody else's life, and just, I mean, it's stressful when you haven't done it before.
Yes, because there's some people are just like, I'm not getting involved, you know, but by all means, that's what 911's for. If you suspect domestic violence, or even if you just see somebody that this looks out of place walking through a neighborhood, going door to door, I mean, the police, I mean, we're civil servants. That's what we're here for. So don't hesitate to call the police. I mean, if it doesn't look right, call the police. Let them check it out. That's what they're paid for. Don't hesitate ever to call the police if you hear what you think's domestic violence, because I mean, honestly, you could probably be saving somebody's life. But, you know, and I can also, you know, there's a non-emergency number. If you don't think it's an emergency and you don't want to call 911, you can call 574-7111 and just hit option 5, and that's the non-emergency number. So, like, if you just think, you know, hey, this guy's knocking door to door, or this car just doesn't look right in my neighborhood, you can call that number and they'll send an officer out to check on it.
You can also send anonymous tips through our webpage as well. So I know we get those quite often as far as like DV is concerned and all that kind of stuff. So, and even if it doesn't rise to the level of something where a police officer needs to be involved, then it can be something that we send over to our victim services unit, which is a lot more comforting to some people that, you know, a civilian, not a police officer, or, you know, somebody getting on the phone saying, hey, this is detective such and such, you know, it's a lot more comforting to them to hear from someone like that than it is necessarily a police officer. So.
Are there any more questions?
Andrea says that she has a question for Dr. Furman when it's appropriate.
Seems like it's now.
are there recommendations on routine COVID testing for healthcare workers?
Yes, I mean, it depends on your, you know, where your health system is. U of L is not testing every healthcare worker in U of L Health at this point. I mean, they might get to that point, but, you know, we are testing all the patients before they have all these procedures, you know, they're going to surgery. So I haven't seen recommendations on routine COVID testing for healthcare workers. I know in the nursing homes, long-term care, they're testing all the staff and all the patients. So there is routine testing of all healthcare workers in the nursing homes. But I don't know, maybe somebody else has heard, but I have not heard that they're routinely testing all healthcare workers. I think it's health system by health system.
I think there's also another question that was asked earlier that we missed for you, Christian. Is there a way to find out when parades are planned for long-term care facilities that people could join if they are able to show support?
Yeah, I saw that, Cheryl. I'm sorry. I'm glad you mentioned that, Dr. Fall. So, you know, I don't know of it. I'll bring it up at our task force meeting. You know, maybe there's a way that we can start publicizing it. But I think, yeah, I don't know. I have not heard of any one place where all these are kind of being hosted and where you could find out all this information. So I think, you know, basically if you live close to one, contact them and find out if they're having it, because most of these facilities are starting to have that now that the weather's nicer. But unless somebody else knows of a central location where this is posted, I don't know of a central location. Maybe we can do that as part of the Traeger Institute.
Yeah, I was thinking the same thing. We really could. So if you know of anything, you could send it to us and we can try to publicize it out to our listservs,
yeah,
and on our website.
Mm-hmm. Yeah, because they're fun. I mean, if you've gone to one of those parades, I mean, it helps lift your spirits too, you know, so everybody's
right.
kind of so, the COVID has really affected people's psyche, and it's nice to be able to do some good things. So, yeah, let us know and we'll put it on our website. And I think, Andrew, you said, you know, are we confident in the efficacy of the self-administered swabs? Yeah, a lot of places are going to where, you know, you do it yourself and we're not sure what to do with their own practice. Yeah, I mean, I think really the recommendation is to be tested. Everybody should be tested. It's just a matter of the logistics, but there is enough testing in Kentucky, is my understanding, that everybody can be tested that wants to be. It used to be that you had to have symptoms, fever, shortness of breath, cough to be tested, but now they're really testing anybody. So, and the swabs, like, you know, it's supposed to go to the very, very back, but some people are saying now just the front nares is okay. It kind of also depends on when you do it, because, you know, after the first part of the virus, it's in the front, but then it goes into your lungs, and then it has to be a bronchoscopy to really get the results. So, you know, I think we're all just doing the best we can. I don't think everybody knows 100% for sure. But definitely some tests are better than others. I think these scams, talking about scams, you know, don't pay cash for any tests, because some of these are total scam testing that's out there. So you should not, you know, your insurance should be paying for this. And then Amy said, Amy Crittenden with Oasis, is Nazareth Home is having a drive-by this Thursday at 2. Oh, good. Okay. And that's their, oh yeah, you put the address, the Newburgh Road one. Oh, good. This Thursday at 2. For Older American Month, I think a lot of these facilities are doing it.
Any more questions?
There, and then Colby, there is the expectation of payment at testing sites, correct, and should be covered by insurance. Yes, yeah. So you should not be paying cash for any of it. Insurance should be covering it. At the very beginning, like U of L was doing testing for free, but even U of L now is charging insurance companies. It depends on if there's a grant. Sometimes there's a grant, but you should not have to pay. Your insurance company or the grant or something should be paying. There's no cash involved. Yeah, it's not free, right? Somebody's paying. There's nothing's free.
So we want to thank the Louisville Metro Police Department for this great conversation. And please be aware when you are out there to look for when you see scams, to look for when you see potential abuse, and make sure you notify the authorities on that. We are going to keep this conversation going on COVID-19 every Tuesday. We hope to talk to the Kentucky Restaurant Association about what it means for us to reopen the restaurants. We're talking also shortly with someone from public health about the CDC guidelines for reopening and how we should adhere to that and what we should do. We plan to talk to some of our colleagues in Pikeville soon, that they can share what they are doing in that part of the state with COVID-19. So we've got a lot of very interesting topics lined up for us on Tuesdays, and we welcome you back every Tuesday. Thank you so much, everyone, for being on this call with us today.
Thanks for having us.
Thank you.
Appreciate your work.